So our first slide is just kind of a couple of introductions because we've had some School of Nursing leadership changes in this last recent time. Talise, if you could go to the next slide. And our leadership changes has been, some goodbyes and some hellos for people. So Dr. Deborah Barksdale was with us for about 6 years, I guess. And she just recently took a dean position at University of North Carolina in Greensboro. So I probably talk to her every week or so. She's keeping me abreast of the things going on, but we really did benefit tremendously from Deborah's leadership here at the school while she was with us. And I know that the Carolina nursing are going to benefit greatly from having her lead in Greensboro. And then a familiar face back at VCU. So Dr. Shelley Conroy used to be on our faculty years ago, and she has been a dean actually most recently at Baylor. And she and her husband made the decision to come back to Richmond. They have family here. And gosh, that's a darn thing for us, right? To have somebody of her caliber move back to Richmond. So she called me and she said, do you have any positions? It's like, well, yeah, I have positions. So she is now our associate dean for the graduate programs and department chair. And then a familiar face to many of you, Dr. Suzanne Armringer. Suzanne has been on our faculty for a number of years and served most recently as the interim associate dean for research while we were conducting our search for the research dean. And after Dr. Barksdale's departure, Suzanne applied for the associate dean for academic programs. We did have a competitive search, and Suzanne was our pick for that. And so she's in her first 6 months of learning that role and really doing a fantastic job. I'm really pleased with where she's at with that. So the next slide then shows you then our current leadership team. And I just put this up here because I think it is hard when you see just the periodic Connections magazine come out or periodic emails from the school trying to keep track of who's who. So our leadership group includes Dr. Armringer and Dr. Conroy, who I just mentioned. Dr. Angela Duncan, the third person on the top. She's our associate dean for diversity, equity, inclusion, and she is actually in a shared position with the College of Health Professions. Dr. Pam Parsons continues to do her work as our associate dean for practice and community engagement. Absolutely stellar person on our team. Our research dean, many of you may have remembered hearing or meeting her at some point, Dr. Amy Salisbury, first person on the bottom row. She has been with us now for just over a year. Mr. Sterling Daniel is in the middle there. He is our associate dean for business and finance, and oh my gosh, so good. We really do rely on his expertise in so many ways. And then the last person, Dr. Christine Wind, who is our associate dean for undergraduate programs and department chair. So what's interesting is that I've actually been very successful at recruiting senior level people to our School of Nursing to really help our school thrive with a lot of faculty mentorship. Dr. Conroy, as I mentioned, had previously been a dean at Baylor. Dr. Wind had moved to Richmond after being a dean in Ohio. And I also still have the benefit of Dr. Michael Bly, who still works with us part-time. He was formerly a dean in 2 different nursing schools. So the depth of leadership expertise in our school is really quite astounding. The next slide, somebody was asking about faculty in one of the questions. So I thought I would just share a slide about, well, how many faculty do we have? What's funny is it feels like we're always hiring, but between hiring and then departures, either due to retirement or people taking associate dean jobs in other schools, we always stay somewhere around anywhere from 50, 52. At the moment, we're at 48. Actually, no, we're at 50 again because we just started a new semester and have 2 new faculty. So we are at 50. We have, and that's full-time faculty. And then we have 5 part-time faculty that are almost full-time, but they're just under the threshold there. We've got about 50 FTEs between full-time and part-time, and actually that should say 52 FTEs. And then adjunct faculty, roughly 80 to 90, depending on the semester. And gosh, we're always hiring. We have an associate dean for undergraduate programs posting because Dr. Wind, who you saw on the previous slide, is retiring in July. So we are hoping we can get another person hired prior to her departure. Dr. Michael Bly is wanting to quit working so much, and he is wanting to step down from the center director and then just teach with us on a very limited part-time basis and mentor students and faculty. So we are searching for a new Langston Center director. That posting's been up for a couple months, I guess. We've got 2 postings for research faculty, always looking for particularly senior research faculty. We've got a posting for a Psych NP and a clinical simulation faculty member and a maternal child faculty member. 2 of those we should be filling. We had fantastic applicants in December, and I'm anticipating that we'll be making offers to the simulation and the maternal child faculty. So that's very exciting for us. So that's real quickly about faculty. And the next slide, we are going to talk about academics. So what's happening in our academic world, just a couple things to share. Actually, there's a whole lot going on, but I'm just trying to keep this just high level. So you can move the slide to Lise. In our academics, probably the biggest news since we last visited is we did have a successful approval with our accreditation. The CCNE is our accreditor, and also the Virginia Board of Nursing approval. So we are good through 2031 for both of those agencies. And maybe that will be my last accreditation. I just don't know that I'm going to be here in 10 years, but I guess I should be careful about saying what I will or won't do, because it is funny how time catches up with you. And, you know, anyway, so this is a big accomplishment, really, and it really spoke to volumes about our faculty and staff working together to really have very, very strong reports for both of these agencies. The next slide, somebody was asking about enrollment. And so our enrollment in the fall was 911 students. You can see the majority of those are undergraduate. We've got 3 programs still, a traditional accelerated and an RN to BS program. Our graduate enrollment is very healthy. We've got a master's, postmaster certificate, a DNP, and a Ph.D. with different tracks in these different degrees. I would say that our enrollment request for placements is very, very high with undergraduate. We still have lots and lots of applicants, lots of people wanting to apply to become nurses. We are seeing nationally a drop off in graduate applications, and probably this is being fueled by COVID and who might otherwise have thought, I'd like to go to graduate school. People are just tired right now. So it's not saying that we're not getting applicants, but the number of applications are less robust than they have been in the past few years. And I've talked to some of my colleagues in other schools, and they're seeing similar drop off. So we will see what it looks like for spring. Let's see the next slide. Somebody was asking about COVID and how is COVID affecting nursing? Oh gosh. I don't have enough time to talk about that in detail, other than to say, I think you all read the paper and see the stress and see the challenges that our nurses in the health systems are under. And it's not just nurses, it's all the health professions are really buckling under the pressure of COVID. Our school and our students, I would say, have fared very, very well with this. You know, we're finishing 2 years of this. We're still in it. I think that we have gotten to a point where we have learned to live with this. Our students take care of COVID patients. When this first came out, We couldn't even go into the health system because we didn't know enough about what we didn't know to make this safe. But, you fast forward 2 years later and our students are in the health system taking care of patients, whether they have COVID or not. And that's part of the landscape of healthcare. And COVID's not going to go away. So this is something that we most of the nursing schools and actually all of the health profession schools at VCU are not limiting clinical education at all. Our students are back on campus, believe it or not. So they do have to wear masks in class. Faculty wear masks in class, and this is our new normal right now. But overall, I guess I would just say, I think the success that we've had with COVID has been because we, number one, had a very, very strong, organized university response. Some of my colleagues in other universities, they were asking the nursing school, what should we do? Because they weren't part of a health science center, and the nursing deans were trying to read the CDC guidelines and figure out what recommendations to make for the whole university or their schools. And in our case, we had an entire health system. And so obviously we were consulted, but this did not fall on the School of Nursing to have to sort out. But we certainly had a lot of input into our response. But that made it very tolerable, and we really had great input from so many entities across campus. So I would say that our response and our guidance at the university level was exceptional. So I think that really contributed to us successfully navigating COVID. I'm trying to think if there was any question. Somebody had asked, let's see, are there enough resources? Yeah, so one of the things that we know with the COVID it's not a new thing because of COVID, but it has accelerated or exacerbated the problem is the compassion fatigue and resilience in healthcare. So a lot of health professions are indeed dealing with problems with self-care, with healthcare professionals and their ability to continue on. One of the things that's interesting that is happened is across all the health professions, and lots of literature out about the need for us to be more intentional about incorporating self-care behaviors and wellness and resilience concepts in the curriculum. But it's not just teaching them about it, it's also role modeling these things. And just in fact, yesterday, one of our senior faculty, Dr. Joe Robbins, did a presentation to our faculty about wellness, resilience, and fatigue. And this in preparation for the curricular work that we'll be undertaking this upcoming year as we realign our curricula to the new AACN essentials that have been released. So this is clearly on our mind, and it's something that I think we'll continue to be talking about well into the future. One other thing that I can share about academic nursing, and Talise, you can move the slide forward, is that we've done some restructuring, more detail than what you probably need to know, but you might see that the titles of some of the things have changed a little bit. But our academic restructuring is kind of like a merger, if you will. So to try to explain this without getting too complicated, our graduate nursing in the United States has been undergoing a lot of changes with this DNP and master's degrees. So you've got a traditional master's degree, and you've got now this doctor of nursing practice. And this doctor of nursing practice has been around now, 15 years or so. Both of those degrees potentially prepare nurse practitioners. And so it's a matter of, do you get a nurse practitioner as a master's prepared nurse and then later go back for a doctoral degree, either a DNP or a Ph.D., or do you go directly into a DNP program and earn your, get your nurse practitioner certification? Or do you get your master's degree and then go back, like I said before, I already said that. So it's caused a lot of confusion actually for schools and for students. And so what we have decided to do, since we have both programs, is we have merged our oversight for the nurse practitioner and nursing administrative leadership under one committee with two degree outcomes. So we call it the Graduate Practice Committee, and that committee manages the academic degrees of both the master's and the DNP, because they're both preparing nurse practitioners and nursing administration leadership. Over time, it's possible that the master's degree will be phased out. That is the track that's happening nationally, but we're certainly not there at this time. But if you can just imagine trying to have two different curriculum committees making decisions about nurse practitioner education when most of those courses are shared, it would have become a little challenging for the faculty to be able to keep things straight. So I think it was a really good decision for us to do this. Let's see what is next. I think next we're going to talk about research just briefly. And what I'll say about research is wow and wow and wow. We hired a new research dean that I mentioned about 1.5 years ago, Amy Salisbury. You can move to the next slide. And Amy has really stepped up our research in such an amazing way. You all probably will recall that there was a lot of research activity when Dr. Nancy Langston was here. And when I came on, things had tapered off a bit. There's a lot of senior researchers that had left or were retiring. And so we kind of had a lull between senior researchers that were getting a lot of funding. And it took us a bit of time to get to reestablish a lot of productivity in that area. So I really credit a lot of that work to previous Associate Dean, Dr. Debbie McGuire, who had helped rebuild an infrastructure, if you will, with the Office of Research and a more consistent and deliberate process for grant submissions. And I know that was a little bit of a change for the faculty, but it has made a difference. Really, it has. So Dr. McGuire retired, and we brought Dr. Salisbury in, and she has not missed a beat, and in fact has ushered in this amazing collaborative perspective, and I think it's going to up our game even more. So you can see last year we were well beyond our targets, and we are way in front on our proposals and our awards and our research spending this year. So we are in a great place. They have, I don't know how many proposals are going in just this month, but there's a lot of grant activity. And the other thing that I'm really pleased with is that it had started previously, but again, Dr. Salisbury coming in with a different lens. Our non-research faculty, that would be our term faculty, are encouraged in even a better way than before, and mentored in a better way to get involved with grant applications and scholarly activity through their practice and or education and or getting connected with some of the other researchers. So we've got this huge shift going on with scholarly activity just in general in the school, and I could not be more proud of where we are with that, and more good things to come on that one. And then in the area of practice and community engagement, I could say wow, wow, wow again. There's so many good things going on in the school, and this is another area. Dr. Pam Parsons, as you probably have heard over time, has led the Richmond Health and Wellness Program, and this is a community-based wellness for older adults. They're out into the housing and Richmond City housing, and that has grown from a little project as a HRSA grant back in 2013 to really a major university initiative with lots and lots and lots of resources and expansion. And they're actually writing a grant right now to make it a mobile unit, a mobile wellness clinic to reach different parts of the state. So it is just fascinating to see Pam work and see how she can take these ideas and just continue to grow them, and not just grow them for the sake of growing, but really meeting a community-based need. We have presence now in the East End in what we call the health hub down in Churchill. And so at the health hub, it's no longer just about older adults. It's now meeting the needs of the community, whoever comes in, and they've been orchestrating, COVID vaccinations along with every other thing that they could possibly need. So she's just knocking this out of the park. But the other thing that's going on that is just as exciting, if not more exciting, and you can go to the next, go to the next slide, Talise, is that we finally have established a nurse practitioner faculty practice at the School of Nursing. So this is maybe the most important thing that we've accomplished since I've been dean. And I say that because Barbie, I think you're the one that Barbie Dunn had said something about, yeah, we tried this 30 years ago. And I know this was something that Nancy Langston had tried to establish. So we finally got the MCVP, that's the Medical College of Virginia Physicians Group, to sign an MOU with us. And essentially what it means is our nurse practitioner faculty who want to practice there have their time bought out by MCVP, and it becomes then their practice is part of their faculty work plan. In the past, what has had to happen is faculty either had to find a free clinic of some kind and volunteer maybe for 4 hours a week, and they could count that as service, or a lot of them were working on the side in some practice, and they had to do it on their own free time. So this is actually launching us into what it should look like in an academic medical center, where nurse practitioners are able, like the physicians, to have practice as part of their work plan, as part of their expectation. So we got the MOU signed earlier I guess it's been almost a year ago. We formally launched July 1 because it took several months for us to get through the red tape of getting the credentialing and so forth sorted out with MCVP. And so we started with 3 nurse practitioners, and we had several nurse practitioners in our faculty that I kind of took I think we'll wait and see what happens with this rather than jumping in. But the 3 that have started with us, it's going very, very well. And we now have 3 or 4 that will be joining in the second cohort. So we're going to be going from 3 people to 6 to 7 by July 1, 2022. And from there, I think it's just going to continue to grow. One of the reasons that this has also been so important for us is that it's going to make a difference in our ability to recruit nurse practitioner faculty. Already, since we initiated this, I have had 2 nurse practitioner faculty applicants who told me the reason they are applying at VCU is because we've got this process now. It will make a difference. And if we want to have a robust nurse practitioner programs, the best thing is for the faculty to be engaged in practice and for our students to be able to be in clinical practice with them from time to time. This is what it's supposed to look like. So it's going to take a few years for us to get at full capacity, but I will tell you that any nurse practitioner that I hire moving forward, it will be one of the things that we talk about as part of their work plan, unless they're a researcher and they're doing research. But if they're coming in as a clinician for teaching in the NP program, then I want them having a component of their time in clinical practice. This really changes then also the dynamics of the capacity that we have for our NP program. So this is so huge. I can't tell you enough how big this is, but it's been something that has, it's kind of like the icing on the cake for me, because I remember when I came here, I remember talking to the gentleman who used to be our VP, and I said, this is something that we have to do. And he said, yeah, okay, we can do that. But it took us all this time to do it. And I don't think there was probably enough clarity at the MCVP or the health system side to understand why this was so important. We have known for years as nurses and as a school, we've always known that this is what we should be doing. But I'm so pleased that we finally got that done. So that's the last of my slides, and I think I was going to try to just go
Jean,
for about 30 minutes.
Jean, I was going to ask you one question here. I see Nancy Langston popped in here and wondering about the revenue plan for these appointments. Since we're kind of on the topic, maybe if you could go ahead and address that. And she also says in all caps, congratulations.
Yeah. Well, so Nancy, it's good news, bad news. So the bad news is there's no revenue generation. In other words, we're not going to have income coming into the school. But what the win is that the salaries are being bought out. So it's a contractual arrangement that those nursing faculty, if it's 20% of effort as a practice, then we're getting 20% of their salary in return from the MCVP. We did talk for quite a while about whether or not the School of Nursing does the billing for their services and the whole bit. And we really did determine, and this was gosh, lots and lots of conversation, that we would probably be better off keeping this clean and leaving it alone, that they continue to do the billing. They continue to own the revenues, because quite honestly, if you are a nurse at the MCVP now and you're seeing patients, they're on a salary. They're not getting the revenue directly based on their own. They have expectations about how many patients they see, but those nurses are not getting the revenue directly. It goes into the business and they collect a salary. So this is essentially the same thing. And we didn't want to create a different dynamic for our nurse practitioner faculty, that they're seeing patients and having the money come to them. We just left it clean. And it's essentially, instead of paying them the salary, it's coming to the School of Nursing in reimbursement for their time. So that's how we've worked it. And you know, maybe at some point in the future, if we set up our own shop, but that's not where we are right now, but it could be something that we do in the future. So the last slide is simply just a question slide. And I had planned to talk for maybe up to 30 minutes and then really just give us an opportunity to just ask questions or whatever's on your mind. And I think you can take us out of the screen share at this point, Talise, so people can see each other a little more easily. Yeah, there we go.
All right. Well, Jean, really appreciate the updates. And I know our team had taken a bit of a break from doing these types of events back in about the spring of 2021. So I'm really pleased that we're able to bring these back and kick things back off with the town hall and these really fantastic updates. So from here, there were a couple of questions. I know you addressed a few of them during your presentation, but I would like to ask a couple of questions that were submitted ahead of time and then open the floor up for anybody else. So first question is, what has been your biggest challenge as dean during the pandemic?
Oh gosh, what has been the biggest challenge? You know, that's really hard. I guess it would say being able to write out the continually changing information that was coming at us, especially in the early days of the pandemic. Everybody had questions. The students were upset because we would tell them this is what we're going to do, and then the guidelines would change, and then we had to send an email out and tell them now we're going to do this and now it's this. So there was so much churn of information and so many changes that trying to keep up with all of that, trying to make sure that people understood where we were, and trying to get people to stay calm. Our students were extremely anxious, obviously, about not being able to finish their degrees on time because we took them out of clinical for several months. Well, we had to figure out how to get them back in clinical and make the time up, and we did. The other thing was just to continue to support our faculty. The faculty really rose to the occasion. They were there was never a question about whether we should be doing what we needed to do. It was, here's what we need to do, and they made it happen. And were they tired? Yes. But they did it. And it was just so, I was just so pleased with the way everybody responded. But, you know, the biggest challenge probably was just the ongoing communication changes that we had. And it was nobody's fault. It was just reacting to, you know, CDC changed their guidelines, then the state changed their guidelines, and the university changed their guidelines. And then there would be another round of this stuff. And it was just, it was wild. But that was actually the experience that we had in 2020. 2021 was much calmer.
All right, next question, Jean, is about our clinical sites and how are you handling the need for clinical sites? And are you kind of issues you might be running into on that front?
We've actually been doing okay with clinical site placements, and here's why. Number one, well, it's all about relationships. So you've got to maintain good relationships with your health system so that they're willing to take your students. VCU Health has always been historically a great partner and has always done what they can to work with us to get our students placed. So if it wasn't for the VCU Health system, we would probably, I'd be answering this question probably very differently. But in addition to that, it's reaching out to other opportunities and exploring different things. So, you know, you have an idea about alternative clinical sites, and it might take you 6 months to a year to have that come to fruition. So you're always having to look ahead to figure out what other options might be out there and then explore those. We took the position with HCA not to look at them as, yeah, they're competition for VCU Health, but they're a very large system with a lot of clinical sites. And guess what? They want more baccalaureate prepared nurses. They know that the best way to recruit baccalaureate prepared nurses into their system is for students while they're in the BSN programs to have clinical experiences with them. So we nurtured a relationship over time, and right now we have a fairly large number of students who have clinical rotations through the HCA system. I think it's really a valuable thing for us to do for two reasons. One, it gives us additional clinical capacity, and we have increased our undergraduate pre-licensure enrollment quite a bit since I've been here. So we're taking in 200 new students a year for pre-licensure education. So that's a lot of clinical sites when you start adding up the number of groups that you need. But the second piece is that a better rounded education means that they're going to be exposed to more than just VCU Health for their clinical education. So most of our students still go to VCU Health when they graduate, but it does provide a nice rounding out for their clinical education to have other places. But we still go to the VA, and then we have a lot of community sites that we have expanded on. And that community expansion has largely been the result of Pam Parsons and our faculty who work in the communities at looking for other opportunities and nurturing those relationships. So we're doing okay with clinical education. I would like to actually expand enrollment more, but before I expand enrollment more, because we need more nurses, right? We have to just be careful that we're making sure that we have those clinical sites, and probably just as more challenging is finding, you know, making sure we have enough faculty to teach those students. So, but it's a great question.
All right, and then I have one more question here that was submitted ahead of time. It's kind of a two-parter, and the topic is on psychiatric mental health nursing. So the first question, has the need for medical nurses decreased the focus of psychiatric mental health nursing in the school curriculum? And the second part to that, among the graduate faculty, what is the ratio of medically oriented faculty to psych mental health faculty?
Yeah, I saw that question. I wasn't really sure how to answer some of this. So our curriculum still has psych mental health, and I wouldn't say that the amount of medical surgical has increased substantially. What we have done more of is more community-based nursing. And of course, community-based nursing addresses all sorts of areas of specialty. So that's not related to any one thing. But and then in terms of the faculty, we currently have 3 full-time, 3 FTEs for psych mental health nurses. And I'm trying to hire a 4th one. And the reason is because it comes back to this practice plan. The way to get more nurse practitioners to work in your school is to give them an opportunity to practice. So if I have our NP faculty in a 40% practice, that's 40% lost teaching capacity or service capacity. So I need more bodies to still have the same teaching capacity. So we've got 3 full-time faculty. I'm going to add a 4th. 2 of them are currently in practice. 1 is thinking about going into practice, and then I have to interview the other person. The one who's thinking about it is still finishing a doctoral degree, and then after that, we'll see what that person does. But yeah, we're gonna continue to hire more NP faculty in general, whether it's psych or acute care or whatever those faculty needs are. And if they're in practice, I can have more people because their time is being bought out and help with the salary support.
All right, so Jean, so again, that wraps up kind of all the questions that were submitted ahead of time to me. And it looks like, Becky, you've just posted another question here in the chat. Do your NP faculty have to practice to continue to be certified?
Yeah, they do. So the difference with this NP practice that I'm talking about is it's part of their job. It's a component of their full-time faculty job, as opposed to them having to get a job outside of their full-time faculty job to be able to keep their clinical hours up. So that's the difference. And it really is, I think, going to make a huge difference for our recruitment, as I said. Okay.
And I think, again, so kind of we've wrapped up what would be the pre-submitted questions. And at this point, some of you may also need to start logging off, but I invite some of you to unmute yourselves and ask questions or make any comments. And I'll make kind of one preemptive comment before you hang up, that Talise will be sending out a survey after the end of today's call. We really appreciate your feedback and input. Again, it's our plan to keep hosting these types of events. So if there are certain topics that would be meaningful to you that you'd like to learn more about, will you please share those ideas with us? We'd really appreciate that. And let's see from here, I'll let anybody take themselves off of mute as you see fit. And we have someone who did direct message me talking about helping nurses with self-care to avoid burnout. I think, Jean, you might have touched a little bit about on this in terms of compassion during the presentation, but if there's anything else that you'd like to add regarding that topic?
No, I think I addressed it. We are going to be incorporating that more intentionally in our curriculum in the future, and that's, you know, a lot of the national guidelines are suggesting that too. I think somebody was getting ready to answer that question.
Jean, I
was just going to ask, this is Judy. It was just, Hi, this is Judy Collins, and I was just going to ask if Harry Tallheimer is going to apply to the School of Nursing.
I was told that it requires talent and it was left at that. When I already tried. Jean told me to just stick to my knitting.
Judy, to Harry's point, it's a very competitive application process. So, yeah.
Harry, we'd love to have you.
So now you've opened it up. So I'm going to be the bad guy here. First of all, you know, I'm just a community person, and now with my hat on, I got to say this. I am so proud of what the School of Nursing does and has done for years, but what's going on now in the face of this unbelievable environment. Every time I talk to somebody involved in healthcare, whether it's at VCU or anywhere around the country, I just say my heart goes out to the people who are dealing with this in the face of an irrational population, incredible caseload, conflicting messages, lack of resources, people not wanting to go to work, people behaving badly. I'm so proud of what you all are doing, and it's incredible. This is not a paid political announcement. Jean, you know, I think the world of you and what you've done and what your team has done. And we also know that the great healthcare systems of the world don't run because of the doctors and the administrators. It's the nurses that make it happen. It's the nurses that take care of the patients. It's the nurses that make the patients loyal. And on a development side, people remember how they were treated. We got great docs and great administrators, but we have better nurses. I congratulate you on that.
Yeah.
Now that I've said that, the world is short of professional and you know, all different levels of nursing. We know that. And my question for you is a business question. You're very competitive, and you can only take but so many people. You've only got so much space and so much capacity. Is anybody talking about enlarging and expanding capacity physically, financially, and is it anybody sitting behind you pushing that? Because it's going to take a lot more money than anybody's talking about right now. And it's not just going to be contributed funds, it's going to be committed funds. And if we can help, I'm on board.
You know, Harry, it's a timely question. Here's why. I've been just this last week working with the Virginia Nurses Association deans. We're called the VACN, Virginia Association of Colleges of Nursing Deans. So this would be the deans of the four-year schools in Virginia, working with our government relations folks to put in a counter proposal to something that the Virginia Community College system had put in. And without getting into all the details of what's going on, there is a recognized need for increasing capacity. I think there's a difference of opinion on what that should look like. And so we've been trying to navigate that a little bit. If we can get legislative support for additional funds for expanding nursing, you can better believe that that's something we will act on. But even without that additional funding, really one of the things that we do need to do is think differently about how we go about educating, because we're not very efficient in our current system. In terms of space goes, we can always look at other models for getting the didactic content to students. But at the end of the day, we still need to have clinical sites and we still need to have faculty. And even if you gave me a whole bunch of money, I still have to hire faculty, and the shortage of faculty is oftentimes where we end up with some challenges. So one of the things that we want to propose is figuring out a different pipeline for getting more clinically relevant nurses into faculty positions, and then giving them the training they need to get them over the hump of being in faculty positions. So it's a complex problem with no easy solution, I guess is probably the best way I can.
I just want to jump back in and ask the question. I understand that, I respect that, and I believe that. But my question is, within the universe of Virginia Commonwealth University, are we looking at this specifically as it pertains to us and our future? Because
yeah, I've been having conversations for sure about how can we expand more. Absolutely.
Are you being supported in that? That's my question. And do you
Yeah,
need help?
absolutely.
Okay.
It's a matter of one of the things I'm looking for is not just expanding without additional resources, but the additional resources that we would need, including scholarship funds. So we've got it's a complex thing, but yes, it is part of the conversations that we're having.
Thank you.
Yeah, thanks for asking that.
Jean, this is Nancy.
Hi, Nancy.
How are you? Two totally unrelated questions, but maybe
Okay.
somewhat. You mentioned the decreased applicant pool for our graduate programs. Was that across all of the graduate programs? I know we were seeing substantial reduction in Ph.D. interest across the nation.
Yeah.
Has that continued, and is it now also the DNP programs?
I think in general, there are fewer applications for graduate nursing education, just in general. Of the graduate programs, it's the PhD pipeline that is suffering probably the most, because I think a lot of people looking at graduate nursing education are still seeing the nurse practitioner as a desirable way to advance their careers and advance their income, quite honestly, with NP salaries.
Mhm. Okay. Then my second question related to faculty positions, and I remember, as you well know, a decade ago now, we annually had request for new faculty positions. That was always our request. Seldom did we get any. So I think that harkens back to Harry's question. Is there university support for new faculty positions? I recall even when they increased undergraduate tuition and created funds, we got a very minimal amount of those funds that were derived from undergraduate enrollment increases. So has that climate changed?
There has been a climate change, and the change has been primarily this. We're on a different budget model. So the school gets the revenues for tuition. And we have to pay a central tax, as you know. But with the new budget model, assuming they don't change it on us and go back to the incremental budget model, if I increase more students, then I get more tuition.
Great.
I can use that tuition how I want. I still have to request hiring. I have to request a posting because they need to look to make sure. Is David Allen still on? I saw him pop in. Maybe he's gone now, but we do have to have oversight at the university so that deans don't, go crazy and put 15 postings out and they don't have the funds to be able to support them. So we do have that kind of a checks and balances. But if I want to hire, 5 staff people instead of a faculty member, that's my prerogative. Or if I decide that I need this faculty or that faculty, it's a matter of getting the approval to post the positions. But I have to be able to manage my funds. So the good news is, and you remember the game that you used to play, I used to play when I first came here, is that June 30th, they sweep all your funds back. And so you're trying to spend all your money before the June 30th deadline. Now the game is, it's really what kind of a reserve can I build? And then making sure that we're smart about how that reserve looks to the university. You don't want your reserve to get so big that people won't give you any resources. So, but yeah, that's the game changer.
Thank you.
Mm-hmm.
Sounds like a model from a private university model, that it's your resources, you generate them. You get to determine how to use them. Good.
So the challenge that you get into with this kind of a model, though, is you have to pay the central tax.
Right. How much is it?
Yeah. Well, it's a percentage of the total amount. And I
that's what I meant.
Yeah. And it can change. So if the provost office decides they need 5 new positions, that becomes central support. So there is a certain tax that you have to pay into the central support. Now, up to now, there hasn't been a lot of argument about that. Where you get into challenges financially is, I'll give you a good example. We need to do some remodeling and renovation for our CLC lab. In fact, expand it because we've got more students. We don't have enough space. Our space was designed in 2005 when they were designing the building. So things have changed a lot. We'd like to do a remodel of it, and trying to get university funds to help support that is a challenge because the university is short on funds. So, those are just some of the things that we have to be patient with and negotiate.
Thank you.
You bet.
Trish, you have your hand raised.
Yeah. So I want to be cognizant of the time. Just briefly, Pam was kind enough to send me an article about one of the students who was in the community college program,
Yes.
Which is dear to my heart as a former community college graduate who came to VCU to get my bachelor's. How has that helped or hindered the pipeline for getting students in and graduated?
Thanks for that question, Trish. So for context for everybody else, what she's referring to is a community college partnership we have with we just signed a fourth one, 4 now community colleges. And the partnership allows students who are eligible, meaning they have to meet certain academic requirements in their last year of their community college education, can start taking RN to BS in courses with us. So the idea is if they get in this track, by the time they finish their community college nursing degree, they will already have had 12 credits completed toward their RN to BS. So it shortens the amount of time needed before they earn that bachelor's degree. So it's an accelerated RN to BS. The other thing that we've done to try to entice that is offer tuition support. We will pay for the tuition while they are co-enrolled, because as community college students, they may have financial aid, but the financial aid only goes to one institution. You can't split your financial aid between 2 institutions. Most of those community college students do not have resources to write a check for their tuition to take extra classes while they're in school. They're already broke, right? So we
No.
are committed to those students who are co-enrolled. We are committed to them getting tuition support for their courses that they're taking while they're still graduating with their baccalaureate, their associate's degree. As far as how successful it's been, I would say it's like a little fledgling bird. It's out of the nest. It's trying to learn to fly. We have had students in there and they are successful once they get in. Our biggest challenge is getting the students into the program. Part of it is communicating with the community colleges and making students aware of it. The other part, though, is having enough students who meet the eligibility requirements in order to start taking the classes. So our most logical target for these classes are going to be people who have already done a lot of the prerequisites for baccalaureate degrees that can take that extra class while they're in the community college. So we'll continue to nurture it and work it. And I think once we get the right secret sauce for getting these people in the pipeline, I think it will probably flourish. I'm counting on it. It's a great question.
Mm-hmm. And we're almost to time, but Tom, you've got your hand raised if you'd like to wrap things up for us today.
Sure. Well, Jean, I'd like to congratulate you also on such a great job you all have done, and especially in the last 2 years. But my question, I just was reading an article in the paper this week about the nurses leaving the profession because of all the stress. And do you think there's a disconnect between hospital systems and the nurses and what they're going through? And it's great to train all these people, but if they don't stay in the profession, it's kind of a catch-22.
Yeah, that's a great question, Tom, and it is heartbreaking to see this happening. And is it a disconnect between the health system and the nurses? I don't know. Is it a disconnect between academics and practice? I don't know. Maybe a little bit of all of those things. Truthfully, I think any of the health professions, especially nursing, have had to do so much for so long that you do reach a limit. And I do believe that a lot of this is just burnout. So, if we would have had more courses in nursing school about self-care and resilience, would it have made a difference? Maybe for some people. I think we would still have this phenomena happening. But I don't know that it's a one causation factor, other than probably the biggest cause is COVID, and it won't go away. We're tired of it. I'm tired of it. Everybody's tired of it.
And we're all tired of it. Oh my gosh.
Oh, so if we could just get this thing gone. But...
Yeah. Well, I do want to be cognizant of everybody's time, our dean's time. It's 3:00. And thanks everyone for coming today. Again, you'll see a survey from police. We'd appreciate your input, feedback, and any thoughts that you have. And any final thoughts, Jean, that you have as we get ready to hang up?
No, just so pleased that you joined today, and so grateful for all of your support. You all are amazing. We have an amazing school. We have so much to be proud of, and I'm just glad to have your support, continued support. So thank you. Appreciate it. Have a great
Thanks,
afternoon.
everybody.
Bye.
Yeah.